channel. My name is Alotte and I am a physical therapist. In today's video, I am going to show you exercises that patient can do when they lose their balance, being coordinated, or pretty much like losing that strength on the legs, especially if you just come out from the hospital or from just staying in the bed the whole time or in the wheelchair for a long time, and now you're just getting ready into putting that weight bearing on your legs. And we call this exercises as kitchen sink exercises. Doesn't matter if you are not in the kitchen. If you're in the kitchen, well and good. All you needed to do is really find a countertop so you could hold it on. This countertop might be a little bit too low for me because I am wearing a little bit of high heels that just come from work. There's something that you can hold onto, a countertop, sink. That's what we call it, kitchen sink exercises, because the sink, you could pretty much like hold onto it while you are doing these exercises. Ideally, I will not recommend that you're going to do this just by yourself initially, even if you are holding on into something sturdy, just because if you needed help, then there should be someone as a standby assist for you. Okay? With the kitchen sink exercises, this is pretty much more like standing. This is just an introductory part, just to kick off your weight bearing on the lower legs and start your exercises by loading your joints on your ankles, your knee, your hips, and to be more upright as possible. If you need an assistant to do this, ideally someone would hold onto you in your hips, or you can put like a belt right around here, so that person that's going to assist you will be holding on into that belt apart from you holding onto the sink. So this is a very good exercise after you're doing the exercises on the chair or on the bed as well. Okay, which I'm going to show it to you later too, especially if you just come off from the hospital and there's still something that you can do while you'll be lying down or when you're just sitting position. Doesn't matter which position you're doing, there's always something that you can do to get some strength on your legs despite not being more upright and standing. But today I'm going to show you the exercises when you are standing. Okay? So if you're new to my channel, please consider subscribing, as I am now starting to focus on the exercises that I usually would give to my patients. And at this point in time, even if you're not the patient itself, but if there's someone that you could help within the family, or anybody, close friend, relatives, that you are able to help and to get back on track and get more strength on that legs while doing it in standing position. So this will be a very good exercises for you. And so you can subscribe to this channel and you hit the notification bell so you would be notified on the upcoming exercises that I may post later on. Okay, so I'm a little bit serious today. I just come from work. Like right off the bat, introduce these exercises, which I keep like putting off for quite a long time. But here I am, and I did have the time to do this. So learn something. So the first thing you're going to do is to do heel raises. So make sure that you're holding your hands on the kitchen counter, any counter that is very stable for you, and you're just gonna do heel raises up and down. 2, 3, 4, 5, 6, 7, 8, second one that you're going to do is this time you're going to raise your toes up. Okay? So I'm just showing it to you on the side, but this time you still have to hold to the counter. Okay? Okay. So this time toes up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. So if I'm holding the counter top like this, it will look like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now the next of the exercises that we are going to do is this knee bending. So I'm just showing it to you in the front, and this is how it looks like when you look at it on the sides. And I'm going to show it to you while holding into the counter. Okay, ready to go. 1. You only count on one side, so you will have 10 on each side. 3, 4, 5, 6, 7, 8, 9, and 10. Okay. The next one is you're just gonna do side steps. Okay, like this. Okay, all right. So showing you holding the countertops and go side step, side. 1 more. You can go all the way as far as your sink can go. I mean, the counter can, depending on how long is your countertop. But I'm just showing to you 2 steps on each side. And make sure that you're holding while you are making that steps. Okay? And then back to the middle. Okay. Now, if you are really unstable, I want you to have someone to look at you and just to be like a standby assist should you need assistance. Just make sure that you hold on to the counter and make sure that your counter is stable enough to hold you as well. Okay, probably not too low or actually not too high too. Okay, the next one is this. We're gonna do this. This time you're not gonna make a step, but just push your straight leg to the side. Okay? Alright. So this is how it would look like. 1. Now keep your foot as straight as possible to the front. 2, 3, 4, 5, 6, 7, 8, 9, 10. Now just the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Just make sure that when you do that exercise, that you don't do this and then bend your body to one side. Okay? It doesn't matter if it's not really too high, where you could push your leg to the side, as long as your body is upright as possible. Okay? Now I'm going to show you how you do it like in a wrong way, like this, or like this. Okay, because you're using a different kind of muscle. You're actually doing hip hiking instead of just pushing your leg to the side. This is the correct one. This is incorrect. Okay, or do like this. That's also incorrect. Okay, now the next one is you're just gonna bend your knee to the back. Okay, I'm showing to you on the side. It would look like this. Okay, not like that, because that's different. Your whole leg, your upper thigh should be just straight as possible, and then you just bend on the knee joint, just like this. Okay, showing it to you on the side. 3, 4, 5. Now I'm going to show it to you when you are facing the counter. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Doing the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the next exercise is when we are going to push your whole leg to the back. Okay? Now, there's a lot of things that could go wrong doing these exercises. You're not going to do this if you try so hard to push your leg to the back. Now the leg should be as straight as possible. It doesn't matter if this is the only range you can go, as long as you don't bend forward. Okay, and you're also not doing this. Okay, alright, let me show it to you. On the side first, do this. 1, hold straight. 2, keep your body straight as possible. 3, 4, 5. Now I'm showing to you when you're holding the kitchen counter or any counter. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, as you can see that the foot is always pointing forward as you push your leg towards the back. Not this and not also this one. Okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, the next one is squatting. Now, if I show it to you in the front, just put your legs a little bit wider, not too wide, not also too narrow, just about shoulder width apart. Okay, wherever the shoulder is, that's in line with your foot. Okay, so if I'm going to show it to you, you just do a mini squat. Okay, just about 45 degrees. Like, you can bend your knee, but you can still see the front of your foot. Okay, about like 30 to 45 degrees. Okay, if you can do a little bit more, well and good, but not like that, not also like this. Okay, so just do a mini squat. Doesn't matter if you can just go deep a little bit and make sure that you're not bending forward. You're also not bending backwards. Okay, I'm going to show it to you first in the front. I'll just do 5, but you're not going to be doing this one. You're doing the countertop exercise. You have to be facing the countertop. If you do it, if you look at me on the side, this is how it would look like. Now keep your body as straight as possible. 3, 4, 5. Now you're going to look at me on the back when I'm doing it on the kitchen counter. Shoulder width apart. Hold to the counter. Go 1, 2. You'll do it slow as possible. 3, so you have better control. 4, 5, 6, 7, 8, 9,